A healthy hip joint should be able to flex to about 125 degrees. The angle is measured from the extended position, like standing or lying down flat, as the knee is brought toward the chest. If the quads, adductors, and/or hip flexors are tight, the femoral head could be pulled forward and in, causing the femoral head to hit the acetabulum prematurely. This would make it impossible to continue to flex the hip through the full range of motion. This will impede squatting, sitting, and being able to lift one's leg up and over objects. This situation is very common in athletes and in people who spend a great deal of time sitting. If the glutes and hamstrings are weak, this can create a similar situation. The lack of posterior muscular activity allows the femoral head to shift forward during hip motions. Compensatory tightness to stabilize the joint, and relatively more strength in the quads, adductors, and hip flexors can pull the femoral head out of position. This is a common problem for people who tend to be very flexible. If the lateral hip, rotators, and/or glutes are overly tight, the femur can be forced into lateral rotation. During hip flexion, extremely tight hamstrings will also very directly limit hip flexion and may also contribute to lateral rotation of the femur. By experimenting with different methods of massage, specific stretches, and using well-chosen exercises, you can uncover the layers of issues specific to any given person. Once balance, coordination, and strength are restored, full hip range of motion is also restored.